So this is that one I was talking about, the velocity for this one, okay? This is, based on 2000, services performed after 2019, but I'm just showing directly the documentation, limitations. So the following indications on concern not medically reasonable, okay? So one is saying is, the one I was talking about, this is the one, the highlighted part.
It is expected that the parasympathetic and sympathetic heart rate testing would be a component of an initial neurologic exam. It would not be considered a significant separately identifiable service when performed on the same day as an E&M service performed to evaluate signs and read the rest of it. Signs, and there should be another section to that, symptoms of possible autonomic dysfunction. See, what you're doing is you're doing your E&M service for pain. You're not doing your E&M service for parasympathetic, sympathetic heart rate testing or neurologic directly. That's the differentiation. You're doing two separate, because you don't have that information yet. You're not directly treating it. This is an ancillary service to get to that diagnosis. We haven't had anybody say, hey, because what we're doing is we're refilling medications and we're getting a pain history over here, and then we've gotten a metabolic history over here, which are two separate identifiable services, even though they're the same thing at the end of the day. But it's the services performed to evaluate signs and symptoms of autonomic dysfunction are different than what the E&M is being done over here, because they're different sets of codes.
What percentage of the patients are going to do the testing?
Well, if they qualify on step one, 99% will do the testing. Because we'll have diagnosed them with a index of suspicion, a review of system, and then you'll have confirmed it with biologic testing. And 99% will qualify for step.
And they are saying here only once per year here, frequent.
Yeah, but what they are saying is, if you do if you perform this test unusually high portion of their patients, then that means again it is I'm looking for the artists and everything. There is
I know that they say that test is exceeding one per year, maybe subject to medical review, except that if you have diagnosis that you're getting, you can do it 2 to 3 times a year. But I agree with you that if you purely as a screening test, and you're not doing it for a therapeutic index, you don't need therapy that's attached, then you better only do it 1 time a year. If you have a therapeutic intervention, revalidating it, but we recommend 2.1 to 2.5 is what the average is. But if you're not doing any coaching with this, I agree. 1 time a year is all that you can do for screening, because that's what the neurologist does, is they screen, they diagnose, and they say, okay, see you next year. And they're not doing any coaching. You're closing the loop with coaching. And then you have to know what your coaching is doing. You have to be able to make sure that you're on the right track to making the patient better. You're looking at those global percentages. You're looking at individual test results.